Let me begin by thanking all of you who have worked so hard to raise consciousness about long COVID. Because right now in our country, there is a hidden public health crisis happening that we cannot ignore, and that is long COVID. Some people who are infected with COVID will develop a long-term illness called long COVID. And that illness can be a debilitating and devastating condition that affects an estimated 16 million adults and 1 million children in this country. And that is likely an undercount. People with long COVID experience hundreds of different symptoms affecting their ability to work, to care for their families, and to live their lives. Many people find themselves confined to their homes, unable to socialize, unable to spend time with their families, and in some cases, unable to even get out of bed. It is having a detrimental impact on people's mental health as well. The impact of long COVID is not just a health issue. It is estimated that 2 to 4 million Americans are out of work due to long COVID. The annual cost of those lost wages alone is around $170 billion a year. We also know that many people with long COVID will confront outrageous healthcare costs as they attempt to manage their symptoms. So, what can we do about this? First, we need to educate our medical professionals about this condition and give them the tools they need to diagnose it. Too many patients are struggling to get their symptoms taken seriously and are having their symptoms dismissed. Next, and perhaps most importantly, we must do everything that we can to find potential treatments and cures for long COVID. In my view, there has been a lack of urgency in Congress, the federal government, and the medical establishment to research and develop new treatments that might cure or lessen the impact of this condition. That has got to change. And that is why I will soon be introducing legislation to substantially increase federal funding to address the long COVID crisis in America. Finally, we need to emphasize the importance of prevention. The best way to prevent long COVID is to avoid getting COVID in the first place. Studies show that with more COVID infections, the likelihood of developing long COVID increases. We must stay up to date on vaccines and wear masks when appropriate. In January, I chaired a hearing on long COVID, bringing together parents, patients, doctors, and researchers to bring greater attention to this condition. One thing is clear: we have a lot of work to do to tackle the issue of long COVID. On this Long COVID Awareness Day, it's important that we commit to doing everything we can to address this crisis with urgency. Once again, thank you all for what you're doing. The time for action is now. Take care.